Hello, today we'll be discussing hypertension and its treatment. Hypertension is defined as the consistent elevation of systemic arterial blood pressure, and there are three factors that contribute to blood pressure: blood volume, the amount of blood circulating throughout the body; peripheral resistance, or the resistance met by the arteries with blood flow; and cardiac output, the amount of blood the heart pumps in per minute. Increases in these will increase blood pressure. Hypertension is a fairly common disease in the United States, occurring in 1 out of every 3 adults, or about 29% of Americans. African American males have the highest rate of hypertension. African Americans are also at a higher risk for variations in their blood pressure, as well as organ failure. Approximately 54,000 Americans die each year from hypertension, and it's a contributing factor to an additional 300,000 deaths per year. There are 3 classes of hypertension used for treatment purposes. The first is prehypertension, which is classified by a systolic pressure of 120 to 139 millimeters of mercury and a diastolic pressure of 80 to 89 millimeters of mercury. The next is stage 1 hypertension, which is classified as a systolic pressure of 140 to 159 millimeters of mercury and a diastolic pressure of 90 to 99 millimeters of mercury. The final stage is stage 2 hypertension, which is classified as a systolic pressure of 160 millimeters of mercury or greater and a diastolic pressure of 100 millimeters of mercury or higher. As a nurse, it's important to understand that fluctuations in blood pressure can be transient and due to things such as stress or pain. The diagnosis of hypertension is typically made only after the patient has had a systolic pressure greater than 140 millimeters of mercury and a diastolic pressure greater than 90 to 99 millimeters of mercury on multiple different clinic visits. Patients with hypertension are at a greater risk for cardiovascular disease, aneurysm, and heart failure. Next, we'll talk about the different drug classes used to treat hypertension. The first class of drugs are diuretics. Diuretics are drugs that increase the rate of urine flow. They were the first widely prescribed class of drugs for the treatment of hypertension. The goal of most diuretic therapy is to reverse abnormal fluid retention by the body. Diuretics are still considered the first line of defense in treating hypertension because they have very few adverse effects. Many different types of diuretics are available for hypertension, and they all produce a similar outcome: the reduction of blood volume through the urinary excretion of water and electrolytes. The most common mechanism by which diuretics act are by blocking sodium ion reabsorption in the nephron, thus sending more sodium to the urine. There are 4 different types of diuretics. The first is thiazide diuretics, which act by blocking the sodium ion in the distal tubule of the kidney. They increase the excretion of potassium. The next, loop diuretics, act on the ascending limb of the loop of Henle. They block the reabsorption of sodium, chloride, and water. They also increase the excretion of potassium. The next, osmotic diuretics, act on the proximal tubule along with the loop of Henle, and they create an osmotic force to reabsorb the water into the nephron and excretes nearly all of the electrolytes. Potassium-sparing diuretics is the final one, and they act on the late distal tubule and collecting ducts to block the reabsorption of sodium. They also reduce the secretion of potassium, but do not increase the excretion of potassium. The next type of drug are ACE inhibitors. The renin-angiotensin-aldosterone system is one of the primary homeostatic mechanisms controlling blood pressure and fluid balance in the body. Drugs that affect this system decrease blood pressure and increase urine volume. Adverse effects of ACE inhibitors are usually minor, but include persistent cough and postural hypotension. Angiotensin-converting enzyme, or ACE, inhibitors prevent angiotensin 1 from being converted to angiotensin 2. ACE inhibitors block the effect of angiotensin 2 by decreasing blood pressure through lowering peripheral resistance and decreasing the blood volume. ACE inhibitors are usually combined with a thiazide diuretic for management of hypertension. Nurses should watch for persistent cough and postural hypotension with the first few doses. Angiotensin 2 is created when renin converts the liver protein angiotensinogen to angiotensin 1. When angiotensin 1 passes through the lungs, it is converted to angiotensin 2. Angiotensin 2 causes intense vasoconstriction of the arterioles, which raises blood pressure by increasing the peripheral resistance. Angiotensin II increases blood pressure through two distinct mechanisms: direct vasoconstriction and increased water retention. ACE inhibitors block the effects of angiotensin II, decreasing blood pressure through two mechanisms: lowering peripheral resistance and decreasing the blood volume. The next class of drugs are calcium channel blockers, which exert beneficial effects on the heart and blood vessels by blocking calcium ion channels. They work by blocking the calcium ion channels and inhibiting calcium from entering the cell, which will then limit muscular contraction. Depending on the dose, calcium channel blockers can help relax smooth muscle, which lowers the peripheral resistance, thus decreasing blood pressure. They vary in their potency and by the frequency and types of adverse effects that they produce. The next class of drugs we'll be talking about are adrenergic antagonists, and there are three types of adrenergic antagonists: beta adrenergic blockers, alpha-1 adrenergic blockers, and alpha-2 adrenergic agonists. The beta adrenergic receptors are found on the heart. This type of drug are considered the first-line drugs for pharmacotherapy of hypertension. By decreasing the heart rate and contractility, they reduce cardiac output and lower systemic blood pressure. Another antihypertensive effect caused by the blockade of the beta-1 receptor includes the secretion and inhibits the secretion of renin and the formation of angiotensin II. The alpha-1 adrenergic receptor is located in the arterioles. Blocking this receptor helps lower blood pressure by directly blocking the sympathetic receptors. This helps cause the vessels to dilate. The adverse effects of this drug is orthostatic hypotension, which is common. Adrenergic and alpha-2 adrenergic antagonists decrease the outflow of sympathetic nerve impulses from the central nervous system to the heart and the arterioles. Direct vasodilators is the next class of drugs we'll talk about, and they cause direct vasodilation and relaxation of arterial smooth muscle. This class of drug is not commonly used anymore because of the serious adverse effects. Although effective at lowering blood pressure, the serious adverse effects include reflex tachycardia. Patients with coronary artery disease could also experience an acute angina attack. Another serious adverse effect of direct vasodilators is sodium and water retention. Next, we'll look specifically into types of medications for hypertension. The first class we discussed were diuretics, and an example of that would be furosemide. Furosemide is indicated for the treatment of hypertension as well as edema, and it is a commonly prescribed diuretic. It inhibits the reabsorption of sodium and chloride from the loop of Henle and the distal renal tubule, and it increases renal excretion of water, sodium, chloride, magnesium, potassium, and calcium. It has a half-life of 30 to 60 minutes, and it's minimally metabolized in the liver with some non-hepatic metabolism. Life-threatening symptoms include erythema multiforme, Stevens-Johnson syndrome, toxic epidermal necrolysis, aplastic anemia, and agranulocytosis. Other drug interactions include an increased risk of methotrexate toxicity as well as an increased risk of salicylate toxicity. Concurrent use of cyclosporine may increase the risk of gouty arthritis, and furosemide may have decreased effects when given at the same time as sucralfate, cholestyramine, and cholestyramine. Nursing considerations for furosemide include monitoring electrolytes and laboratory values such as hepatic function and serum glucose levels. The patient should understand that furosemide controls but does not cure hypertension, and they should consult a healthcare provider regarding diets high in potassium. The next class of drugs we discussed were ACE inhibitors and angiotensin receptor blockers, and an example of this is lisinopril. Lisinopril is indicated in the treatment of hypertension and heart failure management. ACE inhibitors block the conversion of angiotensin I to the vasoconstrictor angiotensin II. This prevents the degradation of bradykinin and other vasodilatory prostaglandins. The net result is systemic vasodilation. The half-life of lisinopril is 12 hours, and it's 100% eliminated by the kidneys. Other interactions include NSAIDs and selective COX-2 inhibitors, which may blunt the antihypertensive effects and increase the risk of renal dysfunction. There's also an increased risk of lithium toxicity, as well as an increased risk of angioedema when used with temsirolimus, sirolimus, and everolimus. Nursing considerations include monitoring blood pressure and pulse with the initial dose, as well as monitoring laboratory values such as serum potassium and serum sodium. The next class of drugs we discussed were calcium channel blockers, which are indicated in the treatment of, and an example of that is nifedipine. And nifedipine is indicated in the treatment of hypertension, angina pectoris, and vasospastic angina. The therapeutic effects of nifedipine include systemic vasodilation, which lowers blood pressure. Nifedipine inhibits calcium transport into the myocardial and vascular smooth muscle cells, and it results in the inhibition of excitation, contraction, coupling, and subsequent contraction. The half-life of nifedipine is 2 to 5 hours and is most commonly metabolized in the liver. Other drug interactions include an increased serum level and risk of toxicity from digoxin, concurrent use with beta blockers, digoxin, disopyramide, pyridamine, and many, which may result in bradycardia, conduction defects, and heart failure. Cimetidine and propranolol may decrease the metabolism and increase the risk of toxicity when used concurrently. And there's an increased risk of GI obstruction when used concurrently with H2 blockers, opioids, NSAIDs, laxatives, anticholinergic drugs, levothyroxine, or neuromuscular blockers. Nursing considerations for calcium channel blockers include monitoring blood pressure and pulse, assessing for signs of heart failure and rash, and monitoring laboratory values such as serum potassium levels periodically. The nurse should also educate the patient to take the medication as directed and to not discontinue even if the patient is feeling well. The nurse should also educate the patient on how to monitor blood pressure at home. The next class of drugs we discussed was adrenergic antagonists. An example of this is doxazosin. Its drug is indicated for the treatment of hypertension. It has therapeutic effects including lowering blood pressure by dilation of the arteries and veins while blocking postsynaptic alpha-1 adrenergic receptors. This drug has a half-life of 22 hours and is extensively metabolized by the liver. Common side effects include dizziness, headache, first dose orthostatic hypotension, arrhythmias, depression, drowsiness, arthritis, gout, decreased libido, and dyspnea. There's an increased risk of hypotension when used with sildenafil, tadalafil, vardenafil, or other antihypertensives, nitrates, or acute ingestion of alcohol. NSAIDs, sympathomimetics, or estrogens may decrease effects of this antihypertensive therapy. Nursing considerations when using doxazosin include monitoring I's and O's and daily weight, as well as assessing for edema, especially at the beginning of therapy. Administering the daily dose at bedtime is also helpful. The next class of drugs we discussed was direct vasodilators. An example of this is hydralazine. Hydralazine is indicated in treatment for moderate to severe hypertension with a diuretic and helps to lower the blood pressure of hypertensive patients. The half-life of hydralazine is 2 to 8 hours, and it's mostly metabolized by the GI mucosa and liver. Other drug interactions include beta blockers, which decrease tachycardia from hydralazine. When used with metoprolol or propranolol, hydralazine levels may increase, and there's also an increased risk of increased blood levels of metoprolol and propranolol. Nursing considerations when using hydralazine, including monitoring blood pressure and pulse, administering the drug PO consistently will enhance absorption, and monitoring diet and exercise. Next, we'll discuss medication compliance in patients with hypertension. The pathophysiology of hypertension is complicated, and there are many systems that can impact blood pressure at the same time. A therapy like single pill combination can treat several mechanisms at the same time, often with few side effects, increasing the likelihood of medication compliance. Overall, blood pressure management has been more successful with single pill combination therapy, as a result, there are many single pill drug combinations on the market to treat hypertension. As we have learned, medication compliance is key in successful treatment of any disease. We suggest you read the article Effective Medication Adherence on Blood Pressure Control and Risk Factors for Antihypertensive Medication Adherence, as it has many important and good points about medication compliance. The information for this article can be found on our last slide. Medication education for hypertensive drug. Patient teaching for furosemide. This drug is used to treat edema due to heart failure and reduces the symptoms of hypertension as well. It is important to work with the patient about compliance, which is taking furosemide as directed. If it is not taken correctly, this could affect the therapeutic effects of the drug. Missed doses should be taken as soon as possible. However, they should not be doubled, as this could increase the risk of serious adverse effects. The patient should understand that they need to change positions slowly, as well as move to standing positions slowly in order to reduce orthostatic hypotension. It's important because some of the adverse effects include dizziness and vertigo. Thus, if the patient moves too quickly, it could put them at greater risk for falling. The patient should be notified that if they seem to be gaining more than 3 pounds a day, they need to call their healthcare provider, as this could be a sign of serious adverse effects. They should also contact their doctor if they are planning to start any new over-the-counter medications, vitamins, or herbal supplements in order to avoid negative drug-to-drug interactions. In terms of serious adverse reactions, the patient should be aware of the fact that they may experience any rash, muscle weakness, cramp, nausea, dizziness, numbness, or tingling of the extremities. They need to call their healthcare provider immediately because these symptoms could be a sign of toxicity. The drug causes photosensitivity as well, so the patient should be instructed on proper sun wear and protection. Non-pharmacological patient teaching includes weight loss, exercise, stress reduction, moderation of alcohol consumption, and quitting smoking. Although furosemide may help reduce the symptoms of hypertension, it will not cure it. The only thing that will truly help make their hypertension better is lifestyle modification. The nurse should make a care plan with the patient that includes goals that are realistic in order for the patient to lead a healthy lifestyle. It's important that even though patients may feel better, they must be told to not stop taking their medication. Keeping a strict and regular medication regimen is essential to avoiding hypertension symptoms and adverse effects. Thank you for listening to our presentation, and here are the references we used throughout the slideshow.